I'm Dr. Liz Caine, a licensed psychologist here at the Alliance Medical Center Behavioral Health Team. And I've got some information about behavioral health services during the time of the COVID-19 pandemic, and some resources that might be helpful in terms of taking care of your mental health and that of your friends and family. The first thing to know is that we are still providing services even though it's at a distance. So we're offering video or telephone visits, the same frequency as we would have had in the past. And we offer services in English and in Spanish. And it's short-term treatment. So if you think you might need something longer term, you can go ahead and call your insurance company and get some referrals. The way to connect with one of our clinicians at Alliance is to go through your primary care physician or just call the health center and get a referral. And you can also ask to speak to somebody in the behavioral health department, and you can get an appointment scheduled for an intake with one of our providers. It can be sometimes kind of anxiety provoking to ask for help. There can be some stigma about needing help or talking to somebody, but actually that's an unfortunate part of our society that doesn't understand that we all need each other. And especially in times like these where there's a lot of extra stress and anxiety and uncertainty, that really coming together and asking for help is really what we need to do, and what all of us do at some point or another in our lives. We all need support at times. If you need something more urgent than calling the health center and getting scheduled with an appointment, you can always call the Sonoma County Warmline. They are available 7 days a week from 10 a.m. to 7 p.m. and their number is 707-565-2652. The Sonoma County Warmline. So that is available to anybody who is a Sonoma County resident. If you're experiencing any emotional disturbances because of the pandemic, or if you know of any loved ones who are, you can reach out for help and talk to somebody there. There's also a crisis text line, which is a national number, and it's really just for texting, and it's 741-741. If you need something even more urgent than that, you can definitely go to your local emergency room or call 911 if it's very emergent. And also, if somebody is experiencing, whether it's you or somebody in your life, suicidal thoughts, which, with the uncertainty of the pandemic, it's definitely increasing people's mental health symptoms, whether it's depression or anxiety. Sometimes people might need some help, and so there's the 24-hour North Bay Suicide Hotline, and that number is 855-587-6373. And actually, on that note, it really is normal to experience extra anxiety during this time. We're not knowing what's going to happen in the future, and we're more distanced from the people that we normally get support from. So it's totally normal to be feeling some extra anxiety, or maybe a little more isolation, feeling, sad that we're not connecting with people. So some things that can be helpful when you're feeling that way is to maintain a regular routine. Routine really helps, especially since that's one of the primary things that we lost. Getting back into some kind of routine, even if it's not exactly the same one you were doing before, is really helpful. Getting outside, especially in the sunshine, that can really uplift our spirits. Getting exercise is really helpful for our mood, as is eating well. Proper nutrition can really shift how we experience our emotions and how we feel in our physical bodies, and that's also going to affect our mood. And it's also great to have proper nutrition when we're concerned about a health crisis. Some other things that are helpful are meditation. And I'm actually going to be offering a guided meditation that you can also listen to. A deep breathing, just pausing to take some deep breaths, that can help. Placing a hand on your heart. When we're feeling a little starved for human touch because we're not as connected as we used to be, we can't just hug our friends like we used to, just a gentle hand on a heart can be really soothing. And then so can a self-hug. So we actually kind of can crisscross our arms with our left hand under our right arm, and our right hand on our left shoulder and just give yourself a little hug. And that can actually help soothe your nervous system. And that can help you feel a little more calm and relaxed, especially if you're feeling some extra anxiety. So definitely reach out to the behavioral health team if you'd like to get some extra support during the pandemic, or even if there was something before the pandemic that was that you were struggling with and would like some extra support. We have appointments available and we're still here for you, even if it's at a distance.